Good afternoon, Liston Gray. My name is Mihiraa. Let's start the warm-up session. How do you communicate with patients effectively as a doctor?
To communicate effectively with patients, doctors should prioritize active listening, empathy, and clear language. Establishing rapport and trust by demonstrating genuine care and respect is crucial. Using plain language and avoiding medical jargon helps ensure patients understand their diagnosis and treatment options. Encouraging questions and addressing concerns promptly fosters a collaborative relationship. Follow-up communication ensures patients feel supported and informed throughout their healthcare experience.
What is the dignity of being a doctor?
The dignity of being a doctor stems from the profound trust patients place in their caregivers during times of vulnerability. It involves upholding ethical principles such as beneficence, non-maleficence, and respect for patient autonomy. Doctors have the privilege of making a positive impact on individual lives and contributing to the betterment of society through their expertise and compassion. The profession is characterized by a commitment to serving others with integrity, empathy, and professionalism. Ultimately, the dignity of being a doctor lies in the profound responsibility to promote health, alleviate suffering, and preserve human dignity.
What are the skills I need to be a doctor?
To become a doctor, you need strong foundational knowledge in medical sciences such as anatomy, physiology, and pathology. Proficiency in clinical skills like history-taking, physical examination, and diagnostic reasoning is essential. Effective communication skills are crucial for building rapport with patients and collaborating with healthcare teams. Problem-solving abilities are necessary for diagnosing medical conditions and developing treatment plans. Finally, empathy, compassion, and professionalism are indispensable qualities for providing patient-centered care and navigating ethical challenges.
How would you deliver bad news to a patient or their family members?
Delivering bad news to a patient or their family members requires sensitivity and compassion. Firstly, I would ensure a private and comfortable setting, allowing for an open and honest conversation. I would begin by expressing empathy and acknowledging the emotional difficulty of the situation. Using clear and simple language, I would deliver the news directly and allow ample time for the patient or family to process and ask questions. Finally, I would offer support resources and reassurance, emphasizing that they are not alone and that we will work together to navigate the challenges ahead.
Describe your ability to handle high-pressure situations.
My ability to handle high-pressure situations as a doctor is grounded in experience, preparation, and resilience. I remain calm and focused and make quick, informed decisions, prioritizing tasks and ensuring clear communication for efficient teamwork. Additionally, I prioritize self-care to recharge amidst demanding circumstances. I view high-pressure situations as opportunities to showcase my skills and dedication to patient care, adapting effectively to ensure the best possible outcomes.
Your preparation time is over. You can now start your role play.
Mihiraa, I can see you're still in a lot of pain, and your voice sounds strained. I'm sorry you're going through this. Could you tell me a bit more about what you're feeling right now?
Oh, Dr. Gray, it's still my back, right here on the right side, just below my ribs. Since this morning, the pain has just been unbearable. I tried rubbing some antispasmodic cream, but it hasn't helped. I'm really worried it might be appendicitis.
I'm sorry to hear that you're in so much pain. Based on what you've described, it sounds like it might not be appendicitis, but rather something else, possibly a kidney stone. I took a urine specimen, and there's blood in it, which makes me quite concerned about a renal calculus, or kidney stone, that may have moved into the ureter. This can cause severe pain like you're experiencing, and it needs to be addressed quickly.
A kidney stone? But can't you just give me something for the pain here? I'm terrified of hospitals, doctor. People go in, and they don't come out the same, or worse, they don't come out at all. I really don't want to go to the hospital.
I understand your fears, Mihiraa, and it's completely normal to feel anxious about hospitals. But let me explain why it's important for you to go. If the stone is blocking your ureter, it can cause serious complications like infections or damage to your kidney. The hospital has the right equipment and specialists to handle this safely and effectively.
But what will happen if I don't go? Can't you treat me here?
Mihiraa, if we don't address the issue promptly, the stone could lead to severe complications, including kidney damage or a serious infection. Here at the clinic, we don't have the tools necessary to remove or break up the stone, which is why I'm recommending the hospital. They will likely perform an X-ray or a CT scan to locate the stone. If it's small, they might let it pass naturally with some pain relief. If it's larger, they can use a procedure called lithotripsy, which uses sound waves to break up the stone. And an open surgery is very unlikely in this case.
I don't know, doctor. I'm just so scared. How long would I be in the hospital? Will I need surgery? And I'm allergic to penicillin, maybe even other medications that I don't know about.
Your concerns are valid, Mihiraa. Thank you for telling me about your penicillin allergy. I'll make sure that's noted and that you're not given anything you're allergic to. As for your stay, if everything goes smoothly, you might just be in the hospital for a day or two. They'll manage your pain, monitor you, and make sure the stone passes or is treated properly. Surgery is a last resort, and it's very unlikely to be needed.
I see. I still don't like the idea, but if it's really necessary.
I know this is a lot to take in, but the sooner we get you treated, the sooner you'll be out of pain and back home. The hospital staff will take good care of you, and I'll be here to follow up with you as soon as you're discharged. Mihiraa, can I go ahead and call an ambulance to take you there safely?
All right, doctor. You can call the ambulance. But please make sure they're aware of my allergies.
Of course, Mihiraa. I'll make sure everything is communicated clearly. You're in good hands. Let's get you feeling better soon. And Mihiraa, to summarize, based on your symptoms and the blood in your urine, I suspect you have a kidney stone, which is causing you severe pain. This condition needs immediate attention in a hospital because if the stone is blocking your ureter, it could cause serious complications like infection or kidney damage. Unfortunately, we can't treat this effectively here at the clinic because we don't have the specialized equipment needed to locate and break up the stone. At the hospital, they'll perform an X-ray or scan to find the stone, and depending on its size, they might let it pass naturally with pain relief or use a non-invasive procedure to break it up. Surgery is very unlikely, and I'll ensure they're aware of your allergies. I understand your fears, but going to the hospital is the safest way to get you pain-free and prevent further complications. I'll call an ambulance now to get you there safely.